Good morning and welcome to Health Talk, sponsored by Mon General Hospital. This program is designed to provide education on vital health topics to help you take charge of your health. You'll also be introduced to Mon General's committed physicians, allied healthcare professionals, and quality programs and services. And now, here are your Health Talk hosts, Kay Murray and Jim Stallings.
Good morning. The Health Talk Show comes your way every Thursday morning, 8:35, brought to you by Mon General Hospital here on WAJR. I'm Jim Stallings along with Kay Murray. Good morning, Kay.
Good morning, James.
And with us in the studio this morning, we have Jonna Mowry. Is it Mowry or Mowry?
It's Mowry.
All right, very good. She's Director of Clinical Systems at Mon General, and Kevin Schaefer is Clinical Systems Analyst. And our topic today obviously must be about clinical systems. Right, Kay?
It's all about technology. I know that. We're going to talk a lot about technology. Before we get into that, I know Greg wanted to talk a little bit about the health fair as well. This is the 30th annual health fair, and you can introduce to us, Greg, a little bit about some of the technology we can get familiar with, but the health fair is coming up.
It sure is, Kay, and we appreciate you guys coming out tomorrow. And you're going to be there from what time? Is it going to be 8:30 to 10?
We're going to be there from 9 to 10 tomorrow through Morgantown AM.
Well, that's going to be great. We appreciate the partnership. And as you mentioned, the health fair continues. We're doing what we can as a community hospital to make a difference in the lives of our patients and neighbors and friends and those we serve. And so from 7 to 5 on Friday, we're going to be open for business at the Morgantown Mall. And then also from 7 to 2 on Saturday. So we've abbreviated the hours a bit on Saturday, but we're going to have the full continuum of screenings that we always do. And then, you mentioned the technology-bent component of the health fair this year. Well, Jonna and Kevin are here to discuss the MyMonGen patient portal, which we think is going to make a really big difference for patients moving forward, just as far as having access to their records or their drugs or their meds or their multiphasic results, just moving forward with that. And then last week on the program, we talked about the technology component of the Ask Abby, and so we talked at length about that. And so that's going to be a feature at the mall as well. And so people are going to have a chance to learn about all the neat new technologies that Mon General is introducing and looking at. And so we feel excited about the chance to serve the community again this year.
And a lot of screenings, a lot of these things are free. So
absolutely, the screenings are free, and it has become so popular that pretty much all of the multiphasic things are full up. And the only way that you can really get multiphasic right now is if you just walk in, and that would happen on a Friday morning or a Saturday morning around 9 o'clock. So you can still do that and then learn about all the new programs and services that we have at the hospital. So, you wouldn't want to miss it. It's a great thing for the community.
Thank you, Greg. I thought that would be a nice introduction before we go in, John and Kevin, talking about my Mon General Patient Portal. What is it? Start there.
Well, we are introducing a patient portal where our patients will have access to their own, clinical information that's stored in the Mon General electronic medical record.
Okay, I tell you what, we're going to take a break. We're going to be back in just a moment. You're listening to the Mon General Show on WAJR.
This is Mon General's Health Talk, providing the information you need to take charge of your health. Call us now with your health-related questions at 304-296-0041.
Tomorrow, Morgantown AM with Kay and Jim. That's us. We'll be broadcasting live from the health fair at the Morgantown Mall from 9 till 10. And we hope that if you're going to be there taking advantage of this great service, that you'll stop by and say hello during our broadcast. And with us in the studio this morning is Jonna Mowry, and she's Director of Clinical Systems at Mon General, and Kevin Schaefer, Clinical Systems Analyst, along with Greg Keeley from Mon General Hospital. And Jean has a question about the health fair. Greg, go ahead, Jean.
Well, it's really not a question. I want to really urge everybody to go and participate in this. This past year, we went as our annual thing, as we do all the time, to do the health fair, the multiphasic. Didn't know anything was wrong, and that night we got a call, and they told me to get my husband to the ER right away. We went in, and through tests and things, we found out he had AML leukemia, and we started treatments, although his body wouldn't take the treatments, but I did get to keep him until August the 30th. He passed away, but that is the only way we had any idea anything was wrong with him. So please, everybody, take advantage of it. It is well worth your time. Thank you.
Jean, we're so sorry to hear about your loss, and you're absolutely right about the importance of the screening. It's like Ben Franklin, an ounce of prevention is worth a pound of cure, and that's the whole approach that we've taken. And another sidebar to that, there was a man who I coached Little League Baseball with, and of course it's so often it's the woman who is dragging the man to these multiphasic screenings or whatever to ensure that they get the testing that they need. And his wife dragged him to a multiphasic, and wouldn't you know it, he had prostate cancer and caught it in the early stages, and it was a lifesaver. He was able to get the treatment that he needed, and now he's back going full swing with his everyday activities. So, we talk about all these free screenings, what the hours are and everything, but nobody really realizes the importance until they actually experience this firsthand, how critical it is that you get screened regularly and talk to your primary care doctor about when you should have your screenings.
Greg, do you think many people just don't make regular appointments at a doctor's office or a hospital to get these screenings done, and it's more convenient for them, or maybe they're more comfortable with going to some place like the Morgantown Mall?
Well, some people are more comfortable with that. Other people are more comfortable utilizing their primary care doctor. But one point that I wanted to make about this, too, is that we want to make sure that you have a chance to talk to your primary care doctor. If you do come to the health fair, you have PSA or multiphasic lab testing done, and you don't have a primary care doctor, please call us at 285-2730, 285-2730. If you don't have a primary care physician, we will try and get you lined up with someone who can help you interpret those lab results and then get you on the road to wellness, basically. And we want to make sure that you are aware of all the tests on an annual basis that you need to do to ensure your best health.
Let's go back to John and Kevin now. And for this 2-day health event, the hospital will be unveiling its new MyMonGen patient portal and a new web-based diabetes program. Kevin, talk a little bit about what we're going to see and what we're going to learn at the health fair.
Well, what's nice about the personal health record, which is part of MyMonGen, is it allows you to be able to track stuff like your diabetes, and you can connect devices to track your blood sugar. You can also connect exercise devices like a Fitbit, also a weight scale, and you can kind of keep track of your fitness and just your overall health.
How important is that, Jonna, that we do that for ourselves?
It's very important. As we were just talking about, oftentimes we don't realize what's going on with our body. And what we're seeing today is that we're trying to give our patients better access to their personal health information and sharing with them what medications we have on record for them, what allergies we have on record for them, and so that they can look at that information, they can see their lab results, and they can better manage their health.
I can see this being a great asset for those that have diabetes in following their program. Will they actually be able to see their blood tests and follow where their blood sugars are at certain times?
You can, as Kevin mentioned, connect your glucometer to your MyMonGen account and track that over time. So you can do a wireless upload if you're interested in doing that, or you can manually enter the data. And that allows you to track your blood sugars every day if you choose to do that. And then when you go to your physician, you can show them that information over time. And it then becomes a better partnership with the patient and their provider with managing their health.
I always kind of yield to the seniors that may not be familiar with being on a computer and all this technology that we're talking about. So what about those individuals? Would this be pretty simple for them to get familiar with and perhaps help someone instruct them how to do it? Kevin?
Yeah, definitely. I mean, the nice thing about having the MyMonGen and the personal health record all tied into one is it's electronic, and the kind of the buzzword right now is it's in the cloud. So it's in a secure place, it's up there, it's in the cloud, and so you don't have to keep track of papers and files, and it's actually in a secure location on the web.
Emphasize more about the security.
Yeah,
though.
that's what I was going to say. What about that?
Yeah, when you get set up for this, you'll actually set up the portal will be your personal username and password. You'll log in, and that's totally secure. You'll keep track of that password and have that information, and it's only available to you. It's not accessible to anybody else. It's like logging into your email account. It's secure.
And navigation is easy. It's right there as soon as we're logging in.
Very simple. There's a kind of a menu pane on the left side that you have links to log into the different areas, whether it be lab or your allergies or medications that are active on file. And then the personal health record actually has a really nice layout where you can track your personal information, like we mentioned before, your measurements and your exercise and fitness, as well as some emergency contact information that can be tied in.
John, how do I sign up? How do I become a part of this?
Right. So if you choose to come to the health fair, which we'd love to see at the health fair and have you sign up there, we will have a booth at the health fair. We will ask you to provide us with a little bit of basic personal information so that we can make sure we have the right person identified. As we said, we want to make sure we secure that information and we share it with only the patient whose information is in the system. So we will ask you for an email address because that's how we're going to send you your link, your personal link. We're going to ask you to provide your date of birth and the last 4 digits of your Social Security number, and that information will simply be verified in our system. Once we've made a positive verification, we will send an email to the patient. And then if you use email, you talked about some folks that maybe aren't as computer savvy. This is as easy as using email. So if you've become comfortable with using email, you would receive an email. You would click on a link, set up your personal password, and then within the actual MyMonGen, it's very much like an email system. So it is very easy to use, very easy to set up. It is easy to use, it's easy to set up, and that's what we wanted to provide, something that would give our patients a very easy way to manage their health.
What if I'm going to 2 or 3 doctors for different things? Will that all come into one base then? All that information?
Right, not electronically at this time. Right now, what you would get is simply your information from Mon General being pushed to your MyMonGen account. However, you can put documents in that personal health record piece. MyMonGen has kind of 2 different elements. One is your connection to Mon General and your data related to the care that you receive at Mon General. The other section is for your own personal tracking, so that you can put different documents in for which providers you're seeing. So you can track it all in one place. As of right now, we can't automatically, we don't have access basically to your information at the other providers to link that.
So when we're at the health fair, we look for the MyMonGen booth. You have your own booth there?
We do. We're booth 20.
20.
Yes, booth 20.
All right. Well, again, at the health fair, screenings include multiphasic blood analysis, ultrasounds of the aorta, carotid, and gallbladder, ultrasounds of the thyroid, echocardiograms, EKGs, blood pressure, finger stick glucose, injury, heart risk assessment, pulmonary function testing, skin cancer, and varicose veins. And one of our callers off the air wanted to know the cost of the PSA test. Greg, do you know what that cost would be?
The cost of the PSA is $15, and so it's a low cost compared to wherever you would get a test in this day and age. So all these screenings are so reasonably priced. It's really important for people to take advantage of these, especially if affordability is an issue. A couple of notes that I wanted to make about this, too, is the Da Vinci robot that was in the flyer as far as a demonstration possibility. We actually have cases with that tomorrow, so I just wanted to make sure that if someone wanted to see the Da Vinci, which I don't know how many people there would be out there, it's going to actually still be at the hospital for that, and I wanted to make a point of that. And also the ever-popular V.K. Raju, who always is open to answering questions, he was scheduled for tomorrow, but he had to go out of town unexpectedly. He will not be there tomorrow. He sends his regards, obviously, but nevertheless, we have all these other neat screenings, and John and Kevin have done such a great job of explaining this patient portal. It really is about the patient, and we're just trying to make sure that we're making a positive difference in the lives of the people that we serve in the community.
And signing up for MyMonGen patient portal is the best price of all. right?
That's right.
It's free.
It's free.
Absolutely free. So you can stop by their booth tomorrow and learn more about it. If you haven't learned enough by the end of this program, make sure you go to Morgantown Mall tomorrow for the health fair, the annual health fair brought to you by Mon General Hospital. We're going to take a break and be back in just a moment. You're listening to Health Talk on the voice of Morgantown, WAJR.
The doctors, the latest news and procedures. Your local health connection is Mon General's Health Talk. If you'd like to be on the show, call 304-296-0041.
The Mon General Health Fair is tomorrow at the Morgantown Mall, and many of you have made appointments to get the multiphasic blood screening. And we had a caller, Greg, who wanted to know if she made one of those appointments but can't actually make it now tomorrow. Can she reschedule her appointment in some way or her screening in some way?
Yeah, we understand the inconveniences of everyday life, and you just can't always make your appointments, and that's fine. What she would need to do if it's a multiphasic is just do a walk-in, and those begin at 9 o'clock on Friday, Saturday, and she could get there a little bit earlier. I think the sign-ups might start a little bit prior to that, but she could still get it done. And also a point, Kay, you were making off air, 12-hour fast is expected of those who want a accurate reading of their lab results.
And, Jonna, if we do come out to the health fair and we sign up for the MyMonGen patient portal, I know that's so hard for me to say, but if we do sign up, could this be a lifestyle change for us when we see our own numbers right there, and if we want to check on those numbers, if we want to really find out what's going on with our body? You think that looks like it might be a lifestyle change?
That's certainly what we're hoping with the launch of our patient portal. MyMonGen should be where you go to look at those lab values. I know oftentimes in the past, I would get the results from my healthcare provider, and they might say everything looked okay. But what did that actually mean? I didn't know exactly what my cholesterol might be unless I went the extra mile and asked him or her to explain that to me and what did it mean. So what you can do is you'll have access to all of your lab values within 72 hours of the results being generated at the hospital. And then you can track that data over time and see how you're improving with your health. You can track your exercise, as Kevin talked about. He mentioned the Fitbit, which is a small device that you wear that tracks your walking and your exercise. And so you can go in, you can look at that information and see, am I making a difference in my health? And what can I be doing to improve some of the data that I'm seeing? I've actually done it. And so I've seen a difference in my own cholesterol. And it's through being aware of what my numbers were and knowing then and educating myself on what I needed to do to improve my health.
Yeah, I was going to ask you about educating ourselves, because we may look at these numbers and not really understand what we're seeing.
Yeah.
Can we then call our doctor if we're not understanding something in the report or the portal?
Absolutely. We encourage you to call your provider if you have any questions. We provide you with your number, and beside your number, we provide you with a normal range. What is an expected value? And so if you look at your number and you're not comfortable with where you are in that normal value, or you're above the normal value or below the normal value, we strongly encourage you to reach out to your personal health care provider to ask for information on what that means. And if you don't, of course, have a personal health care provider, we did provide a number, the 285-2730, and Mon General would like to work with you to get, that type of additional help.
Another great thing about having the health fair at the Morgantown Mall is there's plenty of parking. And Greg, what time will the doors open and we can start coming into the health fair tomorrow?
Well, you can come in as early as 5 a.m., Jim, and I know that you have those early hours as it is most generally, but the event basically kicks off at 7 a.m. It's amazing. I'm there to greet on Friday, Saturday, and boy, the people come pouring in real early. So they can come in early, but the event starts at 7 and it goes 7 to 5 on Friday.
All right. Thank you very much, Greg, and also thank you to Mark and Jonna. Appreciate it.
Kevin,
I'm sorry. Kevin and
That's
Jonna.
That's okay.
You've been listening to Health Talk on WAJR.